Manana Situs Todo Samzu, and welcome to your Guam Congress building. Good morning, and thank you for being in attendance and watching on our public broadcasting systems and other systems. This morning's public hearing is conducted by the Committee on Finance and Government Operations and is called to order at this time 0901 on October 6, 2025. First notice of this public hearing was disseminated to all senators and media outlets on September 29, 2025, with its second notice disseminated on October 3, 2025. These hearing notices were also made available on the Guam Legislature's website and our legislative calendar and the Government of Guam's public portal notice. This morning, the committee will hear testimony on the following bills. Bill number 3-38 COR, introduced by Joe S. and Agustin. It's an act to add a new Chapter 10 to Chapter 11 and Division 1, Title 11, Guam Code Annotated, and add a new Chapter 98 to Division 4, Title 10, Guam Code Annotated, relative to establishing an electronic nicotine delivery system, ENDS, product tax licensing, which shall be cited as the ENDS Excise Act of 2025, and establish a Department of Revenue and Taxation revolving fund and a Guam Memorial Hospital revolving fund. The next bill will be Bill number 187-38 COR, introduced by Sabrina, Salas, Matanane. It's an act to appropriate the sum of $32 million from the general fund realized from bond refinancing savings, not factored into the fiscal year 2026 budget, for capital improvement projects and life-saving supplies and materials at the Guam Memorial Hospital Authority and other health-related facilities. And we will hear Bill 188-38. COR, introduced by Tello T. Tidegui, an act to appropriate the sum of $19,745,714 from the debt service savings resulting from the Government of Guam's business privilege tax and refunding bond Series 225G, which redeemed the Series 2020-15D bonds to the Guam Memorial Hospital Authority for the critical capital improvements and operational costs. At this time, I would like to welcome my colleagues who have joined us today. We have Senator Joe San Agustin, also Senator Sabrina Salas Matanane, Senator Therese Terlahi, and Senator Tello Tidegui. Thank you, colleagues, for joining us this morning. Before we begin, I'd like to remind everyone in attendance of Student Guahan's general rules of conduct. Individuals testifying shall be first recognized by the chairperson before speaking and shall state their full name for record-keeping purposes. Questions and testimony shall be confined to the substance and the nature of the bill on the agenda. Personal inferences to the character or motive of any senator or individual testifying is not permitted. The chairperson of the committee may order the removal from the hearing from any member of Student Guahan or the public in attendance who fails to observe proper decorum pursuant to the 38 Guam Legislature standing rules. Any violation of this general rule of conduct will result in immediate removal from this public hearing room. With that, we will now proceed to hear testimony on Bill number 338 COR, authored by Joe S. San Agustin. Senator San Agustin, you are recognized at this time.
Thank you, Mr. Chairman. I'm going to identify the bill, and then I'll read off. All right? Bill 3-38 COR, an act to add a new Chapter 10 and Chapter 11 to Division 1, Title 2 or Title 11, Guam Code Annotated, and add a new Chapter 98 to Division 4, Title 10, Guam Code Annotated, relative to establishing electronic nicotine delivery system as ENDS, product tax and licensing, which shall be cited as the ENDS Excise Act of 2025. Actually, it's probably 2026 very soon. And establishing a Department of Revenue and Taxation revolving fund and a Guam Memorial Hospital Authority revolving fund. And Mr. Chair, colleagues, stakeholders, and members of our community, those who are watching live on TV and YouTube, thank you for hearing Bill 3 and for the opportunity to speak on this important measure, the ENDS Excise Act of 2025. Bill 3 is my second attempt at establishing a standard regulation on ENDS products. Last term, Bill 193, which is practically the same bill, was introduced and passed, however, was vetoed by Governor Lujan. In her veto message, the governor expressed 3 points These were, 1, that it would allow retailers to import ends products rather than requiring importation through a closely regulated class of wholesalers, and that authorizing retailers to import ends would require DRT to inspect every retail store in the island rather than inspect and regulate the more limited number of wholesalers like tobacco. Bill 3 proposed that 30% of the tax derived from this product will go towards the Department of Revenue and Taxation for compliance and enforcement. The department should be inspecting every store for compliance, not just every wholesaler. 2, also in the veto, the governor stated that the bill would require DRT to levy an excise tax on the final retail sale of ends product in addition to the BBT, further requiring that the excise tax charge be printed on customer receipt as a separate line item because it imposes add-on costs for simple retailers, where the total cost is revealed only after the purchase is completed at the register. Bill 3 proposes that the total of ends product purchase be assessed the tax and for the benefit of the consumer. Requires that amount be stated on the receipt to show that they are paying in that tax. This is good for the consumer. Number 3, the government prefers to treat ends product the same way as cigarettes and other tobacco products by requiring it to go through the warehouse program and to let Revenue and Tax create rules specifying how ends products are processed and taxed. Mr. Chair, I address these points because Bill 3 is simple. We are not reinventing the process. We are creating a simplified process that goes straight to the source. It creates a wholesale and retail license. Once they obtain a license, the retailer will simply charge the purchaser of all ends product a flat tax. Show it on the receipt and remit that payment to Revenue and Tax. Lastly, in that veto letter, the governor stated that it makes sense to implement a common sense taxing structure on ends product, but disagree with having to reinvent the wheel to do so and prefer to use the same tax structure as conventional tobacco and alcohol products. Mr. Chair, conventional tobacco and ends products are very different. I agree with the governor that it makes sense to implement a common sense taxing structure. So what is the issue? This bill contains everything common sense and is not difficult to execute. Again, one would get a license to sell ends product, apply the tax, and remit it to Revenue and Tax without the hassles tobacco wholesalers have expressed as cumbersome for so long. Revenue and Tax would collect and conduct the necessary inspection for compliance. Bill number 3-38 CR advocates balance and accountability. On the other hand, we acknowledge that electronic cigarettes and vaping products are a growing part of our economy, which many adults choose them as an alternative to traditional tobacco or those who may not have smoked traditional cigarettes but started with ends product. On the other hand, this bill will allow us to collect on a non-regulated industry. This proposal sets a clear licensing and regulatory structure for wholesalers and retailers, allowing only responsible enterprises to participate. It also establishes extreme age restriction enforcement methods to ensure that no child under 21 has access to these products by mandating documented compliance, random inspections, and consequences for offenders. We prioritize our youth safety. At the same time, Guam's 20% excess tax provides an acceptable source of revenue. This is much more than just a tax. It is a direct investment in our community. 60% of the revenue will benefit the Guam Memorial Hospital, which is in critical need of finances to operate, maintain buildings, and pay suppliers. 30% will fund the Department of Revenue and Taxation for compliance. The remaining 10% in revenue, as well as fees and fines, will benefit the Department of Public Health Prevention and Education efforts, as well as the Youth Tobacco Education and Prevention Fund, in an effort to break the cycle of addiction at its source. Furthermore, this bill promotes accountability and transparency by requiring quality reporting and annual audit reviews so the public can see exactly how these funds are utilized. Mr. Chair, this is not about penalizing adults who make personal choices. It is about protecting our young, promoting public health, and ensuring that a profitable enterprise in Guam contributes equitably to the island's well-being. I want to thank the ends industry and the Revenue and Tax for working with us on this bill in the last term. Their input was well received and is what crafted the bill. Thank you, Mr. Chairman, for hearing this bill, and I look forward to hearing the testimony told today and hope that we will be able to get this done so we may begin to recover losses from tobacco sales as seen in reports. Si Zeus Masi to all of you for being here. Thank you.
Sidus Masi Parahagulokwi, Senator San Agustin, and I'd like to now welcome the Vice Speaker, Tony Ada, who's also the Vice Chair of this committee. So nice to see the GMH family here today. As promised, this committee stated we would hear several bills. It's October 6th. It's 6 days into the fiscal year to assist GMH with its financial issues and assist it going forward. So that's why we're here today. But first, we'll hear from Reverend Tax on this bill, which also will benefit GMH. And we'd like Marie Lizama to come forward and read her testimony into the record. Sidus Masi, Marie, and you can start anytime you're ready. Identify yourself for the record.
Hafiday, Chairman Dueñas, Senators Salas Matanane, San Agustin, Vice Speaker Ada, Senator Terlahi, and Senator Taidagui. Thank you for the opportunity to provide testimony on Bill 3-38 COR, otherwise known as the ENDS Excise Tax of 2025. We provided input on previous draft legislation, in other words, Bill 193-37, and we are glad to note that some of the recommendations submitted then have been included in this particular bill, 3-38 COR, including but not limited to an increase in the annual retail license from $200 to $500 and to have the licenses expire 1 year from the date in which they were issued or renewed. I apologize, Mr. Chair. I failed to identify myself. I am Marie Lizama. I'm the Director of the Department of Revenue and Taxation. Anyone who sells tobacco and related products are required to have a tobacco retail license in place. And for the period October 1, 2024 to October 3, 2025, there have been a total of 356 licenses. And I failed to include that there are about 9 wholesale licenses. It should be noted, though, that our current reporting process does not separate out ENDS products and are included instead in the retail portion, sales portion of the return. Governments have struggled to determine how best to classify and tax these products. And as Senator San Agustin mentioned, the governor had expressed some of her concerns with that. So part of it is a complex issue, and whether it's by content or related effects, it's part of the struggle for all governments, whether it's internationally or even nationwide, to determine how best to classify that. Many state governments have taken diverse approaches with respect to tax structure and rates. While it is unclear what is ideal for the government of Guam, Bill 3-38 COR takes that first step toward addressing ENDS products as a separate group, and we hope that better practices will eventually emerge. Finally, we appreciate that Bill 3-38 COR contains language that allows for a percentage of fines and fees to be given to DRT in order to assist with compliance and enforcement of tobacco and ENDS laws, rules, and regulations. I should add, it's not part of my written testimony, but I should add that our team is currently still in discussion with regard to certain what the implications will mean internally for DRT. So we do appreciate that there's time that will be given for us to implement, processes should this bill become law. And, again, back to the previous statement, we really don't know what's the best way forward for the implementation, for the taxation of these types of products. But I think we've come to recognize that we need to take that first step and hope that once implemented, that better practices or perhaps a better way forward will emerge. Thank you, and I'm sorry that that's the short testimony that I have for you today.
Jesus, Marie. Jesus Masi Marie Zama from DRT. And as you know, a hallmark of this 38th Guam legislature has been the markup process. So we really look forward to Department of Revenue and Taxation engaging with the committee moving forward. As you've mentioned, there have been a number of changes that will assist this bill going forward in this time.
Yes.
And so I'll recognize the author. Do you want to go last, Senator Snugstein, or would you like to? Okay, so then we'll go in the order of arrival. Senator Terlahi, you're recognized.
Mr. Chair, thank you, Director. And so, Director, can you just explain, do you think the bill then now addresses the governor's veto concerns? Did it?
You know, we have yet to conclude our discussion. We know that there are still some questions, but I do know that there is recognition that there needs to be action taken, and what that ideal way is not entirely clear. You know, we have been in discussion with the policy advisor, and you know, there is no, how do we say, you know, no pushback, so to speak. It's just we want to make sure, or I think there's some concern as to whether or not there's one industry being, you know, favored over another. I believe that was the main concern. I think, Senator, you know, as I mentioned, it really is about maybe taking that first step.
All right. Well, the governor's cited that they should be taxed at the wholesale level, and that the previous bill was allowing retailers to be the importers. And so what do you think this bill does?
So, you know, that again, that is something that the team, we have not finalized as far as our discussion is concerned. There have been some concerns with regard to, you know, if we take a certain action, will that kind of push, you know, perhaps sales that are not able to be readily regulated, you know, and so forth. So, you know, I apologize. Our team, and my team is not here today, but our team is still in discussion with regard to the full implication of the bill. So.
Okay, so you said that the current reporting process does not separate out ends products. Does that mean that they're currently reporting the sales?
So they're lumped in as retail sales. So let's just say...
but not tobacco?
No, so everyone is required, anyone who sells sells these types of products are required to have a retail, tobacco retail license. However, when it comes to reporting, there is no current, it's not currently separated out. It's all lumped in retail. So to that extent, we have no data on you know, exactly how much of retail sales actually relate to or are ends products or related, you know, related products. So we don't have that right now.
I know. I guess I'm asking, so does the bill need to do that? And does the bill do that adequately for your purposes? And are you already taxing, you're just taxing them on regular sales, but are you taxing them under the tobacco category? Are they being grouped together?
Okay, other than the license, no, we are not. And okay. So what the bill would do for us, we would have to develop our own internal policies. And so, you know, that would include the reprogramming of the, or to include it as a separate category under the BPT return.
Okay. And then, yeah, the governor had said it's a burden on you to inspect the retailers as opposed to the wholesalers, but on tobacco you do both, is that correct?
I'm sorry?
When it's tobacco you do both, is that correct?
Correct, yes.
So what do you think this bill is going to require you to do that you're not already doing?
Well, because vape is not currently regulated, you know, it will increase, of course, the efforts or our team's going to have to, it'll add to the team's responsibilities, and so forth. So that is the part that we're going to just simply try to find a way should this bill become law.
All right, so the governor has suggested that rev and tax just create rules and regs. Have you tried to do that?
No, we haven't. We started a discussion, and then when Bill 19337 failed to pass, we did not pick up the discussion from there. But our team is now in discussion with regard to this Bill 338 possibly passing.
All right, so if this bill passes, you're going to be able to implement it, you're saying? You haven't,
We're going to have
you're not
to
rejecting the notion of inspecting retailers like the governor had suggested earlier, or that they be taxed on the wholesale by wholesalers?
We will definitely have to ramp up our compliance efforts and likely get our enforcement people involved as well. So I'm not saying it's going to be easy, it's just that, we will simply have to comply.
All right, and what about the receipt showing the customers the tax?
So that burden will actually be on the, the stores or the places that sell them.
We don't currently do that for anyone, is that correct?
No.
In fact, we've actually rejected that notion for the BPT.
Correct, yeah. So that's on, outside of DRT.
All right. Do you think these are being brought in by retailers versus wholesalers?
I believe that that they're being brought in by retailers.
All right. And then, so the governor had also suggested that we treat them the same as tobacco and not as a separate group. But this bill, in your testimony, says takes the first step towards addressing ENDS product as a separate group, and better practices will emerge. So do you agree now that it should be treated as a separate group?
When I meant that, I meant, that it would be solely, like on its own rather, as opposed to being lumped in with retail sales. So I apologize if the phrasing.
Separate from retail.
Yes, separate from retail.
But what about separate from tobacco?
Right, that's not, yeah. Okay.
So what about
my omission.
The tobacco stamps? Would this be able to apply at all to these products?
So it will not. Part of the discussion we've had with the team is, so the tobacco stamps would be affixed, right? Part of to each packet. Now, the problem with the vaping or ENDS products is, like where their packaging is not uniform, for lack of a better way to say it. It's not done in packets, you could argue there's, and I'm sorry, I don't vape, but, I believe that, there's like a one-time use, there's refillable, I'm not even sure what that's called, but so therein lies the complexity, right? Is it can't be, and some states have actually admitted that they can't use, while they would like to, they can't use the stamps simply because of that, because there is no uniformity with regard to packaging.
All right. Well, I fully support this bill, and we want to support you in implementing it.
Okay.
And I think we need to move on it. So I hope you can give us concrete whatever we need, if any, to make amendments.
Okay.
Before we get it to the floor. Thank you, Mr. Chair.
Senator Chalahi. Senator Sabrina Salas Matanane, you're next.
Thank you, Mr. Chair. And thank you, Marie, for providing your testimony. I did want to ask, because some of your responses are a little vague.
Vague?
Yeah.
Sorry.
So I guess what would be, since you're still taking the initial steps with regulating vapes, what would you say is the easiest way then to capture this revenue?
For me personally, I think if you just did the, value, the percentage based on all ENDS products, whether it's the initial, and I apologize, I don't know the terms, but whether, see, when we had the previous discussion, it was complex because it was a matter of what do we tax it on? Do we tax it on the liquid part of it? Do we also tax the actual heating element, and so forth? So, for us, our initial thoughts were just do a across the board percentage on all ends products, whether it's the refillable part of it, whether it's the one-time use, whether it's the heating element, type of thing. And I believe, Senator, there are other gadgets. I apologize, I am not familiar with everything. I certainly need to take the time to go to the vape shops and, kind of take a look, at that. But we believe that that's probably the easiest for now. And then as we continue along, that we also believe that a better plan, if you will, to tax it will emerge. All jurisdictions are different, and as I mentioned earlier, a lot of the states they all employ different ways to tax these things. They've also come into issues, with them, and the only way really, was for them to implement something in short, and then revisit the process after some time, after it's been implemented.
Does Reven Tax have any statistics on where these vapes are being sold? Because you can find them at the gas station, and then there's their own, shops. Do you guys keep records of that?
No, we do not. We just have who has the tobacco retail licenses, but unfortunately, we don't. Other than that list of who has those licenses, there is no, for example, we have no data on the percentage of its sales. What is the percentage of its retail sales, and so forth. So we have a general idea, but we aren't able currently to drill down.
What's the general idea then?
The 356 licenses. So we have a list of those.
Mm-hmm. And how many more staff would you need if this becomes law to enforce this, to implement this? Would you need additional staff? And
yes, of course, we already struggle, in some branches with shortage of staff. But I believe with this particular, draft legislation, we should expect to have some full-time dedicated staff just to this part alone. Either that or it's included as part of our efforts with regard to tobacco and, just kind of lump it in together with tobacco.
you mentioned in your testimony that you were glad that some of the recommendations submitted from the public hearing on the previous bill, Bill 193, were included in this bill. What recommendations were not included in this bill that you would like to see included?
So I believe there was a recommendation, or we had some concerns with the language in that I, as the director, would determine who would qualify for such a license. I think there was also something there wherein I would be the person who would determine whose license would be revoked and so forth. And that's just something that we're in discussion with right now, as far as, whether or not, it should remain that way. I think the bill does indicate somewhat with regard to a hearing. And so that's just something, again, we're going to need to kind of tighten and make sure that, I'm not subject to being accused of, revoking someone's license just because, or, maybe perhaps someone would have a different interpretation of why I should or shouldn't revoke, a license.
How much in revenue do you think this could generate?
Gosh, I wish I could tell you that. You know, I think it's kind of, you know, because we don't currently parcel it out, you know, but because the bill does allow for a higher percentage or, you know, a specific percentage, I think it's all incremental. It's just, it'll definitely be a plus for us. It'll be another revenue stream.
Thank you, Marie.
You're welcome.
Sidus Masi, Senator Matanane. Senator Tadigui, you recognize?
Thank you, Mr. Chair, and good morning to my colleagues, and good morning to you, Maria. How are you, Marie?
Good. Yeah.
You know, I do support this measure. I think when we tried to go over this bill before, we wanted to make sure that everybody was here in attendance to provide their input. And we had quite a bit of individuals from the vaping community, the retailers come here, and I think a couple people who do wholesale. I'm just surprised that nobody is here today to provide that same kind of testimony or support. I do know that the vape community believes and feels that it is just to tax, you know, vaping. So that's good to hear. But to do it right is important to them, and I'm hoping that, Mr. Chair, we get testimony, because I'm finding out some of the vaping community right now did not know about this public hearing. So it kind of makes it difficult to only hear one side of the story. And hopefully we can have those testimonies coming in. I'm glad to hear that, you know, the education part of this bill is on there. You know, it's important to educate the community. One of the biggest issues that I found during this back and forth of this particular law was the fact that wholesalers are wanting to control the product and having it come in. But most retailers on Guam for vaping actually get their product through the mail. It's brought in. They don't have enough inventory to, you know, keep stocking. They want to keep things fresh. So basically they do it monthly, you know, and bring in small amounts, number one. Number two, they're able to get different types, different grades of vaping. You know, the strength of nicotine that's in the vape is there. Different products from different companies, like one is, you know, Tiger, one is, you know, Speakeasy or something, you know, things like that, different name products. When a wholesaler brings in one particular product from one company to monopolize, you know, the system. So the biggest problem is that. Now, for these retailers, they said that it's easier to do the point of sale, to charge them the tax at the point of sale if they have the capacity system. Now, if they are to get a license, they have to prove that they're able to have that system of point of sale in place at at their shops, right? So that makes sense. Because not only that, on the receipt, you can see where they're being taxed. If it's 20%, which it could, you know, you never know, and bills morph into different, you know, bills once it gets on the session floor, it could do that, but let's say, you know, it's 20%. So when someone's buying a product, they can actually see from the receipt that they are being charged the 20% tax. And that makes sense in two ways. One, they have the security that they can keep tabs when they're doing their BPT, their GRTs on the shop end of the part, and plus the customer sees their part. So I think that the concern is you know, monopolizing, you know, this product by forcing these the realtor to buy from, you know, these wholesalers. Not realtor, but you know what I'm saying.
Retailer.
So these shops, to buy from there. So I see there's a big issue with that. I see there's a controlling and a monopolizing of that system, because I've had someone come to my office trying to convince me of it, and it didn't sound right. And I know for sure all these vape shops are feeling the same, because they don't purchase the same products as this one. And if I'm not mistaken, there is only one wholesaler on this island that actually sells vape products. Only one. So there's some kind of shenanigans going on here. We're gonna weed that out. And I wish the other store owners that sells vape were here today. Like you said, how many licenses are out? But again, the simplicity of it, the transparency of it, I think should be done at the store. Marie, I know you're not very familiar with this, but how do you feel about taking these vape products out of the gas stations and put it in just the stores? Yeah, the establishment that sells, just say, the reason why is that we're having a lot of issues with kids getting their hands on it and going into a gas station, as easy as that, easy to even pickpocket some of the stuff that's nearby, but when you're in one of these stores, they've got cameras everywhere. You can't even step in there unless you're 18 years old. So there's a huge, security concern that we should think about. We talk about these getting in the wrong hands. There's even security cameras outside to see if somebody goes in, buys the vape, and then goes to the car and gives it to, a kid under the age of 18. So how do you feel about moving that out of the gas station or any other place other than a vape shop that has that security?
It certainly would make things easier for our team. It will also perhaps provide greater control. I have come across, some information that, when you have it readily available at all these different places, right? And again, to your point that, they're coming in through, the mail, and so forth. I think kind of narrowing where it can be purchased certainly gives better control for the type of product even. And just because the states have reported that, if you have something that perhaps is out there that's low quality, low price, right? Then that's something that youth and or a group, those consumers that are price sensitive, will gravitate toward. So it certainly would make it easier for the team. At this point in time, we just feel that we need to do something,
Thank you for that, because, also in the vape industry, they have these things that wean people off of tobacco, the nicotine. Yep. And it helps individuals. They do, they go from a certain percentage and they graduate further down until they finally, stop using nicotine. It's not a gum, but, it's another mechanism to do it. So there are some areas in the vape industry that try to wean people off. And then, so I think that's important. And I don't want to see that to be diminished, even on an education process. So that being said, Mr. Chair, I'm hoping to contact, I think maybe even the author of the legislation might have contact too with these industry individuals to come forth and provide their testimony. So it's going to be very helpful. Other than that, a lot of the questions that were asked by good Senator Chalahi was brought up, and it makes a lot of sense. But I think the wholesale part, it's not going to work. It's not. You're hindering these shops from being able to purchase products that they feel is better suited, or it's been studied on it, and are more popular than one company on this island that wholesales, these products. So thank you, Mr. Chair.
Sidusmasi, Senator Tadigui, and just once again, as I mentioned in the opening, all outlets were notified. This has been very publicized in terms of this bill's hearing. But I am willing, like always, from my committee to have not only a markup, but a roundtable meeting, if necessary, to flesh out any other comments that may come from vape companies or other companies. I just wanted to put that on the record for the public and the companies to hear today. I'd like to welcome Senator Gumatauto, has joined us this morning. Senator, do you have any questions for Rev. Tax?
Yes, thank you, Mr. Chair. And I do have a couple, but let me just start kind of going off what you just mentioned a couple minutes ago. If in the markup process, if we can find this out, what specific actions have been taken by relevant government of Guam agencies, including but not limited to Public Health, GDOE, and Guam Behavioral, to address the findings contained in the Guam State Epidemiological Profile 2021 update, which found that 1 in 3, or 35.2% of high school students and nearly 1 in 3, or 34.6% middle school students reported using e-cigarettes or vape products. And pretty much, Mr. Chair, what data is available on any additional research that has been carried out on the matter since the 2021 report, at least in terms of this bill. But I do have just two questions for Maria, and I hope, I'm not sure if you answered them earlier, but I just want to at least get it on the record, or at least at me asking. But recognizing that among the findings contained in OPA report number 2023-02, issued in February of 2023, relative to your agency's assessments and collections of excise taxes for alcohol beverages and tobacco products, one business was listed as an active licensed tobacco bonded warehouse wholesaler, despite having 2 active tax liens with a total BPT liability of $15.1 million. This would go from 2015 up until that report. So what information is available on DRT's actions to date with respect to implementing the OPA's recommendations, including for the department's management to enforce strict licensee compliance, ensuring that all licenses are in fact current with their tax debts?
Okay, so if I'm not mistaken, we did address that particular issue in an oversight hearing conducted, along with the public auditor. And here's the thing with regard to business licenses. You may renew, you may owe taxes, but if you are in an agreement, an installment agreement, and you are up to date with that agreement, there is nothing that prevents us from being able to renew your business license. So, with regard to, I guess that particular thing, and I think, I don't know if there's any disagreement with how that is, but that is actually in the law, that we are not to deny the renewal of a business license if the taxpayer is deemed current with the agreement.
And Marie, so are you also saying that there might be folks who have liens that are still operating, outside of those who may not have a payment plan?
That's a question that's actually better answered by our enforcement division, and I can certainly get that information for you, Senator.
I would hope so for the committees, and if you can, provide it back. And then just one other question regarding a separate OPA review concerning bonded warehouses for tobacco products. How much in tobacco taxes is the government of Guam failing to collect based on what the OPA referenced in 2019 in their report number 19-07, referenced as reliance by DRT on the voluntary compliance of tobacco wholesalers?
So, it's a little challenging in the sense that, we begged then to differ, and we beg to differ now with the comment that there, has been some kind of tax leakage with regard to the bonded warehouse. So what happens is when the container comes in, it is sealed, right? And then, customs alerts us that it's there, and then before the seal can be broken, A representative from DRT is there. The contents are noted. It is kind of closed back up again. It's delivered to the bonded warehouse. Whenever of course, inventory is taken, and whenever a withdrawal is made, there is a person from DRT there, along with the company representative, to account for everything that is being withdrawn. So we feel that that process has been sufficient, if not, good enough for the inventories that come in. I should add that starting this month, the wholesalers will be taking ownership of their respective applicators or machines to be able to affix the stamps to each packet. Now, that we feel is an additional control, on top of the bonded process. I would like to invite any of you to come and witness, that process, and then also provide your input, if you feel that is perhaps not sufficient, or if there's something lacking in any way. But, our team is confident that the current process, works. It's being followed.
All right, thank you, Marie, for that. And thank you, Mr. Chair, for the time. Appreciate you.
Sidus Masi, Senator Gumatauta. At this time, I'll recognize the author for any questions and to possibly close. The Vice Speaker has indicated he doesn't have any questions. Thank you, sir.
All right, thank you, Mr. Chair. Marie, just a little reminder, I used to work at Revenue and Tax, and I was the compliance supervisor.
Yes, sir.
So on the issue of having a requirement for additional folks, I can see to a certain degree, yeah, you may need, but it shouldn't be a burdensome. And the reason why is because as the compliance branch is required to check all business licenses, regardless if it's ends, tobacco, alcohol, or whatever retail. What concerns me more is, the bill was brought, this is the second time this bill. I'm just curious as, and because on other issues, such as I think a couple of my colleagues that's not here, they were considering maybe tax exempting food, tax exempting medical, pharmaceutical items. And I'm just wondering if the department is kind of like looking at the wall, there's writings on the wall, and start preparing drafts. Because if you're not ready to evolve with what's coming down the tube, the department will be caught with, well, we need to go into a planning mode. That planning should have been existing already. The department needs to be prepared. And the reason why I bring this up, Marie, is because this is the second round for this bill. And at the end of the day, it's going to provide funding to the compliance branch, the Department of Revenue and Tax, 30%, and any additional funding that you may need. And when you brought up unfortunately, when you brought up the tobacco stamp, it is not, the burden won't be on the Department of Revenue and Taxation now, it's going to be on the wholesaler themselves. Okay, so, and I got a bill on that one also, but going back to this bill, it just concerns me that, and at one point, I don't know if you're aware of it or even heard about it, is that there was a serious consideration to make the BBT visible so that the people of Guam can see exactly if the BBT was at 5%, every consumer will know when they look at whatever they buy, it's 5% and what that number is. Because now with the BBT reduced to 4.5 and maybe reduced to 4%, everybody needs to know that if it was $2, it's 5% is what, a penny, and so forth. They can see the difference changing, and that's something that if the BBT is not visible, but for the ends, it's going to be visible. I can't see any burden because the retailers are willing to do this. And at the same token, with 30% to revenue and tax to help with compliance, that should almost equip you with an additional person. Ends is, like you mentioned, ends is not separated today. It should have been, because why? If I'm correct, under the business license, there's a form that's filled in by everybody. when they report how much taxes they're paying. I think that should be, I don't know if your office, I see Jerome Ogden is here, he's right behind you. If the department is preparing that already, because like I said, it's evolving, maybe there should have been a draft presented saying, this is where we're going to list it as.
Okay. If I may, sir?
Yes, please.
Yes. Yes, and I'm fully aware that you used to work at the Department of Revenue and Taxation. So, you probably also are aware that, it is, and I hate to make this sound as like an excuse, but it is what it is. And, quite often, our folks we are in reactive mode, right? And it's just the nature of what the agency does. With that said, we agree with you, and anything that comes down, we should actually be preparing for that. With that said, with regard to the separating out of the ends products, there wouldn't be forms to change because all requirements are mandated by law to be electronic, right? So, but with that said, whoever does the programming has to ensure that whatever form is eventually displayed is correct, because when people file their returns, of course, it doesn't automatically mean that they pay right then and there. So they'll take a printout, they'll go over to Treasurer of Guam. In fact, I was even advised the other day that you need to make sure that that is correct with regard to the rollback, because when people go and present their forms, they're making payments based, on that form. So, it is difficult. You probably also know, that compliance also has been trying to handle cannabis. So in addition to cannabis, and all these other things, I think even, it does become quite challenging. I think at one point in time, Senator Terlahi reached out to me with a concern about bingo operators, and I, told her, I said, ma'am, I recognize that your concern, but it is difficult for us to go out, or virtually impossible for our team to go out on a nightly basis, to monitor all these organizations or these centers. With that said, what I do appreciate about your bill is it kind of sets up kind of like a SINAR reporting or operation, in the sense that the team will go out, and of course we don't announce that. That's really, just quite by random dates, and we will be able to see who is or which stores are selling to minors. So that part of it, we are grateful for, and with regard to some of the other stuff, we hope to eventually be there, wherein anytime something is introduced, we're already thinking of that, and then the last piece would be reprogramming, or kind of like checking into the feasibility of implementing such an action.
Okay. And then just going back to how the bill is written, where you identified that you as the director will be responsible for revoking, I think maybe we can tweak the bill, because number one, when you're dealing with a compliance, may it be alcohol or whatever business, when the compliance folks go out there and they issue out a fine, or they're preparing to revoke, it's based on the compliance branch's recommendation to their board,
Correct.
To the director. So it's not really on your shoulders per se, even though you do sign it, but there's a big process. I mean, it could take 24 hours, but it also could take 2 weeks to 3 weeks to process a revocation or a closure. So I understand where you come from, but I just want to make it clear that it's not really on the director, other than the signature to support the board's direction, the compliance officer's recommendation, based on law.
Well, currently, with regard to alcohol, it is at the board's discretion to revoke, based upon the team's recommendation and findings.
Okay. All right. And thank you, Mr. Chair, for allowing me the question. And thank you, Marie, for being here. Take care.
Suzus Masi, Senator San Agustin, and author of Bill 338 COR. So thank you, Marie, for your testimony. As I mentioned, we look forward to meeting with you on the markups of this bill. And like I said earlier, I remain open to hearing, having a roundtable for any other interests should it come into my committee, written or otherwise, for the future going forward on any concerns that vape companies or other tobacco delivery companies or retailers, wholesalers may have any concerns. So
That
once
is
again,
appreciated, sir.
yes, my committee does due diligence on its work. We don't move forward until things are set. So we'll keep doing that until we know this bill's ready for prime time. In the meantime, we'll stand by and get all the work done. So that will conclude the public hearing on Bill 338 COR. The time on that is 9:56. We will move now to the next bill on the agenda, Bill number 18738, introduced by Sabrina Salas Matanane, Christoper Dueñas, and Jesse A. Lujan. Before I go to the author, of course, one of the most operative areas of appropriations is the fiscal note, and I kind of read this one with a little bit of curiosity, and I'll make sure that I open with this at the outset, and I'll explain why. The fiscal note comment says, the Bureau notes that there are inaccuracies with the proposed legislation as the appropriation amount of $32 million to the GMHA will not be available in fiscal year 2026. The accurate amount that will be available for the appropriation is $19,745,714. The co-sponsor of the bill and appropriations chair, Senator Christoper Dueñas, was aware of this amount and should have waited and corrected the proposed legislation to include revision to the appropriations allocations and capital improvement projects and life-saving supplies and materials enumerated. It should also be noted that requests for comments and/or testimony were made to GMHA, Department of Administration, the Guam Economic Development Authority, but no responses were provided to date. I say I read that with curiosity because in the middle of September, when the governor sent down her budget request that was summarily adjourned, she appropriated all $32 million of this money in the fiscal year 2026 proposed budget that the governor sent down. Not one penny of it was appropriated to GMH. There were several other projects that were thought about in her proposal. I believe there was $9 million for the airport, and there was also another proposal for a GPD headquarters up on Tizen, but not $1, not one penny for GMH. So we'll work on the bill, and there are other bills before us today. But one of the other things I mentioned at the GMH hearing was that with anticipated revenues and the governor's transfer authority of now 50% of general fund revenue, there is opportunities, and I even asked Mr. Ed Byrne at the time, there are opportunities for advance allotments to GMH, and that would be predicated on funds available, whether it was in fiscal year 2026 or into the future. So I want to be clear once again, this committee is absolutely committed, along with the health chair, to get as much money as we can to GMH. And whether it's $19 million that can be recognized in this bill for this fiscal year, and plans for the additional revenue that's been realized through the savings in the next fiscal year or advance allotments, we stand ready to assist you. With that, I now recognize the oversight chair for GMH and the author of this good bill, Senator Sabrina Salas Matanane.
Alfadane, thank you, Mr. Chair. I appreciate the opportunity to share the details about Bill number 187. This bill takes $32 million in savings from the Government of Guam's bond refunding, specifically the BPT Series 2025G, which refinanced older bonds from 2015. Now, these savings, as the chairman pointed out, came to light during the governor's substitute budget bill in September. As chair of the Committee on Health, I want the people of Guam to know that I am committed to making sure every dollar of these savings goes directly to the Guam Memorial Hospital. Now, while about $19 million is available this fiscal year, there is another $17 million available in fiscal year 2027. My bill makes sure both amounts together, totaling $36 million, are locked in for GMH. That's actually $4 million more than the original version of my bill. And all of it, again, I want to go to GMH. None of these funds can be used for salaries or hiring. Instead, they are strictly for critical infrastructure projects that affect patient care and safety. The bill will be amended during markup to reflect the full revenue and to include a detailed breakdown of the funds by fiscal year. I'm also working with GMH leadership to finalize which capital improvement projects should be prioritized. That way, the funding lines up directly with the hospital's real needs, whether it's electrical upgrades, fire safety, IT systems, HVAC, or life-saving supplies. And I look forward to hearing their presentation today. For the record, like many of my colleagues, I support building a new hospital. But while we work toward that goal, we must also make sure the hospital we have right now is safe, not just for patients, but for employees who care for them every day. At the end of the day, this bill is about taking the savings and putting them where they are most needed, into GMH, to strengthen it and to help it provide the care our people deserve. It's another example of my commitment to work side by side with the hospital to move things forward. I look forward to today's testimony and to working with all stakeholders to ensure this funding truly makes a difference for GMH and the people of Guam. Sizulis Masi.
Sizus Masi, Senator Sabrina Salas Matanane. So I understand that Dr. Jolene Uggan, the newly appointed CEO, administrator for GMH, is going to be testifying. Please come forward, Doc, and congratulations. I think Gita also, Tina Garcia, is going to be testifying. Anybody else from your various teams that will be supporting you, if they are going to come up, please invite them. Both Dr. Uggan and Tina, whoever you choose to invite, will accept them as well. And so we will recognize you after both the GMH management as well as Gita management present on their testimony. So at this time, I would like to recognize Dr. Jolene Uggan, Sizus Masi. Please identify yourself for the record, and we look forward to your testimony.
Manana Sizulis. I am Dr. Jolene Maatnya Uggan. So Buenas and half a day, Chairman Chris Dueñas, Senator Matanane, and the honorable senators of the 38th Guam Legislature. Thank you for the opportunity to testify on behalf of the Guam Memorial Hospital Authority in strong support of Bill number 18738. This bill isn't just about fixing a building. It's about securing the future of healthcare on our island. The $32 million appropriation before you represent an investment our people have been waiting decades for. An investment in safety, reliability, and dignity for the patients and staff of the Guam Memorial Hospital. The U.S. Army Corps of Engineers assessment of our facility made one thing clear. Our hospital is at a breaking point. The roof has exceeded its lifespan. The Z-wing is unsafe and must be demolished. The electrical and fire protection systems are outdated and place patients and staff at risk. These are not cosmetic repairs. These are life safety issues, and every day we delay, we risk compounding that danger. This bill provides the means to act decisively and responsibly. The $32 million allocation will fund 4 major priorities: abandoned MRI building as well as expanded parking to make the hospital more accessible to patients and families. Utility modernization, nearly $2.5 million will modernize our electrical, fire, and elevator systems, the backbone of hospital safety. Electronic health record, the largest portion, over $27 million, we will finally allow GMH to enter into the 21st century. A modern electronic health record will improve patient safety, billing accuracy and accountability while addressing the serious cybersecurity risks identified in our recent IT assessment. Emergency readiness, $800,000 will upgrade our GMH main facility HVAC system and turn the skilled nursing facility into a ready-to-deploy alternate care site, ensuring that when Guam faces the next public health emergency, we will be prepared. As a physician who has walked these halls and cared for our patients during the most difficult times, I can tell you these aren't luxuries, they are lifelines. This funding is targeted, transparent, and dedicated solely to capital improvement and life safety needs, not personnel or operations. Not personnel, it's fiscal responsibility in action. We also respectfully recommend a small amendment that GMHA be authorized to reprogram funds within the 4 projects categories as actual costs come in, ensuring flexibility to adjust for construction market shifts without exceeding the total appropriation. Members of the legislature, our hospital was built in another era, but our commitment to our people is timeless. By passing Bill 18738, you will help us stabilize the foundation upon which every act of care depends on. This is not just an investment in concrete and steel, it's an investment in trust, safety, and the belief that every life on Guam deserves a hospital that can serve them with dignity and excellence. Sizus Ma'asi for your continued support and partnership in protecting the health of our island.
Parahagulokwi, Senator, or Senator, maybe someday, Dr. Jolene Agun, thank you for your testimony. Once again, congratulations on your appointment. Dr. Eusebio, do you have any comments in the opening?
Yes, I just wanted to add, just to clarify, what Dr. Agun said is that the hospital was initially built from a convent, so that I think a lot of people forget that that's how it was started. And a lot of the infrastructure that was there is still there. We need to upgrade to improve how we're going to deliver care. What is sort of killing 2 birds with 1 stone is something that's very, very important. It integrates everything that we do, from the time a patient comes in to how the patient is evaluated and how treatment is being given to that patient via the materials and professional support that is given to that patient. All those things have to be integrated, and the integration, which is not present and requiring a lot of manpower. Just to be clear, for example, if a patient comes to the emergency room, that patient is evaluated in the emergency room, the documentation, there is everything within the emergency room. If that patient is admitted, is not in the regular electronic health record, CareView. You have to rewrite everything or make copies of everything in order to put it in the patient's chart. So because it's not integrated, it makes the system very inefficient and requires even more manpower. That's just the patient coming in. I'm not talking about integrating supplies, integrating pharmacy, integrating everything else into one system so we can deliver an efficient healthcare. It's the problem. Now, this system, if we establish one, can be the same system that is brought and taken over to the new hospital, so that you have 2 birds in 1 stone. But it needs to be started, it needs to be initiated, and it's going to cost a lot. But I think it's important to be able to integrate the whole thing and to start the process now. And I know that finances are always limited, but we have to start somewhere. And I appreciate the support that you're all giving. We all of us, are servants of the people. And we want to be able to deliver the best care to the people that we serve. And I think that's very, very important, that that's what we want to do, and we want to be able to deliver not only adequate care, we want to deliver the best care. For many, many years, we've always just had an opportunity just to get by. We don't want to get by anymore. We want to deliver the best care. We can only do that with your help. Thank you.
Dr. Eusebio. Tina Garcia, GITA Administrator Director, you're recognized.
Thank you. Good morning, Vice Speaker Atta, Senator Dueñas, and members of the Committee on Government Finance and Operations. My name is Tina Garcia. I'm the current CEO and Administrator at the Guam Economic Development Authority, and I'm here to provide testimony on Bill number 187-38. The new bond debt service for the refunded bonds dropped from $31,405,875 to $11,061,161 for fiscal year 2026, providing for debt service savings of $19,745,714, which is now available for fiscal year 2026 appropriation. The savings from the refunded bonds were not included in the initial fiscal year 2026 executive budget submission that was sent on January 31, 2025. That's why we had the original debt service of $31 million. GITA was unable to disclose the amount of savings during the budget hearings due to the closing of the bond, which occurred on August 2025. So again, we are here to confirm the amount of savings for the current fiscal year 2026 appropriations. Thank you, Senator, and if you have any questions, I'm here to respond.
Tina, and once again, congratulations on your confirmation during our recent session. Senator Salas Matanane, would you like to go last, or would you like to begin your questioning now?
I can go last.
Okay, so I'm going to ask a couple of questions just because I was a little curious on the fiscal note. Tina, were you part of the preparations for the governor's proposed budget that was sent to us in mid-September?
I was not directly involved in the preparation. I think we were just looking at the anticipated savings, but again, we couldn't fully disclose it at the time.
Okay, so you're aware, though, that pretty much the majority of that savings that was recognized was actually accounted for in the governor's proposal, aren't you?
Yes.
Okay, so I'm sure Lester and let me see who else signed this. I don't expect you to answer for them.
Right.
But
Senator, if I may real quickly just state, the reason why, although the session was going on and it wasn't until after the budget was passed that it became known what the savings was after that August 20. If we had the budget, we had the bond closing scheduled for August 20. Up until that point, if we didn't secure all our signatures, if for whatever reason the bond didn't close, we would have had to pause all our efforts to close that bond for the time needed to address the issues. At that time, we were still working with the Attorney General's office and securing the signature, and so it wasn't until the last hour that we were able to actually close on August 20. So again, it was hard to disclose the savings until after that point.
I understand, Tina. So just so we don't mix up what my line of questioning is, I'm talking about the governor's submission of her substitute budget. I'm not talking about the budget that passed via the override. One of the reasons why we were able to do this bill, 187-38, and I believe the other bill that was subsequently introduced, was actually during the discussion on the governor's submission of her budget proposal in September. I forget the exact date when she called us into session. I believe that was session 2, second special session by the governor. The third one was the 40 million, which now GMH has and has a schedule for expenditures from Department of Administration. So my point here is, I totally understand that. In fact, I was aware of the moments before which the bonds were actually sold and all of the documents and everything leading up to that during our budget. So we knew it wasn't going to be available for appropriations in August. But we were very clear that it was going to be available in September because, like I said, the governor was also very aware because the governor found 4 projects that she wanted to fund with it in her submission instead of GMH. So that's my point. So when I read this fiscal note from Joaquin A.J. Guerrero II and Lester Carlson Jr., I'm just a little bit surprised because it seems to me that if we could appropriate 32 million plus in the governor's budget proposal, I would imagine, Tina, you recognize the appropriation authorities
Yes.
from here, right?
Yes, absolutely. But I don't believe, and again, I wasn't part of the discussion, but we would not have encouraged appropriation for the following fiscal year. It would have only been for fiscal 26 because we knew that was being discussed. So we would not have recommended appropriation for the following fiscal year because that again is wasn't on the table at the time.
So whoever prepared the governor's budget was a little bit magodai as well, right?
I don't know. I really don't know where they funded the additional amounts.
Okay.
So I can't confirm whether it was from the savings.
Okay. Well, we are. So what we'll do is we will work on the markup process with regard to this budget. But Dr. Gunn, I guess I have to go back to you. I don't know if you want to maybe bring up some of the project folks, but I'll just ask you directly on this. So the projects you enumerated here for which you would use the 32 million, a couple of them are a little bit different from what the current emergent projects are, such as the electrical panel and let's see, I think it's the IT system. Yeah, maybe we have somebody on the panel that will answer.
In
already.
addition to that.
Oh, this is an addition. Okay, so I want to be clear that then we have a pathway for those projects that we talked about when we were at our oversight hearing at GMH. So, Mr. Kenga, could you identify yourself for the record and maybe you have some answers for that?
Sure, and thank you, Senator. My name is Jesse King. I'm the Personnel Services Administrator. So to accompany our interim CEO's testimony, we did provide handouts to the committee that you can follow along as well. The first one reflects like this. So this is an accounting of the amounts proposed by the bill and illustrates the particular categories that we aim to support with the proceeds. The second bill, or second document, is the 40 million, and so Public Law 38-59 covers operational costs and capital improvements, particularly noted by the chairman about the IT infrastructure and the electrical distribution panel. Those projects have been set aside by the 40 million, and so we undertook the 29 total CIP funds minus the 10 million from a previously passed and enacted public law, giving the difference in this secondary document that's being shared with the committee.
Masi, and that was very well done and very well presented as well. Now it can be clear to our folks exactly why. I think some in the public might think, wait, what happened to the electrical panel and some of that other stuff? So I think it's very clear now, and thank you for that presentation, Mr. Kenga. I guess the only other thing I would ask, I'm sure you had it in your testimony, but I just want on the record one more time, Dr. Ogun, that you would like us to find every way possible to realize this entire 32 million, even if we have to do some different things to mark up the bill, correct?
Absolutely, Senator.
Okay, Masi. So at this point, I'll go ahead and recognize in the order of arrival for questioning from the Senator. Senator Tulahi, you recognize.
Masi, and thank you. I
I'm trying to find in the governor's proposed budget, where else besides Simon Sanchez, she put that BPT bond savings. I see 16 million for Simon Sanchez, but Mr. Chair, would you?
Yeah, I believe there was 9 million for the airport. We can give you the detail. There was 9 million for the airport in terms of their fuel tax needs to be able to retire that debt that they currently have. And I believe there was another $9 to $10 million that was proposed for the GPD headquarters through a, I actually can read that one into the record. That's part of the chapter. But if you want to keep along with your question, I can answer that in the end or try to pull it up right now.
All right.
Yeah,
I'll
so
keep questions.
this was, yeah, this
the
was
9.2 shows
section 56 of the budget. I'm not sure which chapter this is, but GPD headquarters in Tizen, Imagahaganguan is hereby authorized to expend such funds as necessary for the costs associated with financing to include lease-back agreements, design, construction, maintenance, and related expenses of the new Guam Police Department's headquarters located in Tizen that was not in our original budget and did not have a funding source. So I believe that's exactly what was.
All right, so that and the airport's money, not necessarily from this BPT, or no, from the savings from the bond refinancing though, that's what.
It was anticipated. That's what they were using for the funding source because our original budget had transfer authority for the airport through the governor's transfer authority to dispense of that fuel tax. But I believe they had put it in their budget coming from the refinancing.
Yeah, so the bill doesn't specify the refinancing except for Simon Sanchez 16 million. So that's for FY26. But the author of the bill says there's 36 million available, and you said in your letter 31 million over a course of several years. Could you clarify?
Thank you. Thank you for the opportunity to clarify. What we were trying to say is that the governor's initial executive budget had the original debt service of 31.4 million. And then with the new refunded debt service of 11.7 million, that led to a savings of 19.7. So it was the 31 minus the 31.4 minus 11.7, and that's how we got to the 19.7 that was now available for appropriation.
Okay, 19.7 available for FY26, but in subsequent years, what is available?
Well, in subsequent years, again, with the executive budget, we'd only put in the actual debt service. There wouldn't be a savings, but it would just be, it would just flow to the suggested appropriation.
All right, so you recommend the bill reflect 19 point some million for FY26?
Yeah, because that's what is available to date.
All right, and all right, and then to GMH, thank you, doctors, for being here, and to all of you. So this bill appropriates 32 million, but as you've heard, there's really only 19 million some available from this savings source for FY26. So if you were going to prioritize the 19 million, what is your priority? Because right now, the bill prioritizes the parking lot and removal of buildings that are out there in the parking lot. And I'm very shocked because below that, we've got, the fire system, the HVAC, the electrical panel, and all those others seems more critical. But what is your opinion?
So the fire...
What is your plan?
Yeah, so the fire system is actually included under the utility systems. 2.47 million is part of the fire alarm and protection upgrades, the elevator and lift system.
But that's if there's 32 million, this whole list will meet 31 million. But if there's only 19 million available, as we've heard from Gita, what would be the priority for the 19 million?
The priority would be the life safety systems.
Which ones?
So again, the utility system, going back to the fire alarm and protection upgrades, the elevator and lift system, the emergency power supply, and I'm going to turn over to my operations.
Yes, and I can answer that, Senator. So if you look at the critical CIP investment breakdown and the handout, the back page, this can support, 19 million can support all projects with the exception of what we've indicated under IT infrastructure, which is the electronic health record system year 2. So 19 million can support an initial investment on our electronic health care record system in addition to all other activities outlined, including the structural, architectural, utility systems, as well as the alternative care site.
Okay, so you still intend on going forward with this parking infrastructure and removing of buildings. Why is that a priority to remove those buildings right now? Particularly the MRI that's way out there.
It's actually just across the street. So we share the parking lot structure with Jibway. And as you understand, both our patients and persons that arrive to the facility for care struggle for parking. So
no, I understand that. But when we're looking at with this is for CIP, does this give us any guarantee that our vendors are going to be paid? Because when we went through the 40 million, we weren't going to be able to pay off the vendors and do the CIP projects that you said were urgent. And now with this 19 million additional, we're going to do some CIP projects, but no vendor payments while we still have vendors unpaid. Yes.
If I may clarify, Senator, my name is Rodalyn Gerardo. I'm the Assistant Administrator of Operations at the hospital. And so just to clarify, the $19 million, as Jesse had mentioned earlier, is actually part of the original $29.3 million in CIP that we were requesting for the fiscal year 2026 CIP. Because we were requesting for $29.3 million, we've already carved out $10 million from the $40 million that the senators had given us, and so therefore the balance is $19 million. Now the $19 million that we were requesting is all of these back here that Jesse was talking about, with the exception of our EHR, which talks about year 1, year 2. And therefore, that is all of it. And to us, these are still pretty much the priorities that we'd like to accomplish for the hospital.
And if I may, Senator, to address specifically your question about vendor payables. So again, reflecting on the document listed at the 40 million on the backside, we have outlined already the current GMH expenditures, which include the payment already made, $3.9 million to travel nurse agencies, $3.6 million to medical supplies, and $2 million for various critical equipment. There are additional payments that are totaling $4 million that go in various stages of processing, including $167,000 that have been completed awaiting payout, $3.4 million that is being processed with an additional $423,000 awaiting processing. But all of that is already accounted for. I don't think that there is additional amounts that would require from the 32 million for vendor payables because the 40 million should have already erased the existing debt.
That's not what we were told at the oversight hearing. We were told that after the 40 million is spent, that we would still have, that we were not addressing all the vendor payables, right? Because you were using it for critical CIP particularly, and you gave us the list of which ones you were going to use it for. So the amount that you said could be paid from the 40 million, yes, you're going to take care of, but wasn't there also, we had started with 26 million.
Right now, the current, my name is Yuka Hechanova. I'm the Chief Financial Officer at GMH. So we do have, when we presented the accounts payable at the time, it was around $28 million. And so we are using the money from the 40 million to address that payables listing. The payables changes every day. So we have new payments coming in, and as our cash flow comes in, we are addressing it. But when we do have shortfalls, that AP listing starts to grow, and that's the reason why usually by the end or the last quarter of the fiscal year, we're always short and coming back and asking for additional funding. So for now, that 30 million that we're using to pay out vendors is really clearing out our AP prior to the end of FY25.
Say that one more time, the last part.
It's clearing out the AP vendors so we can have them all cleared up for FY25. So FY26 is a new fiscal year, and as we're getting the appropriations and our revenues, that will take care of the current vendors.
Okay, so you're saying when we go into FY26, we have none of those over 90-day due vendor payables, over 60 or over 30 days? They're going to be clear?
Yes.
Okay.
Yes.
How much?
That was...
That was
You're talking
26
about
million
the
at the
over-
time of the budget.
That's the entire accounts payable.
Yeah.
That wasn't broken down by the 30, 60, 90 though.
Okay. All right, so Dr. Jolene, CEO, do you agree then with this priority listing if you receive 19 million versus, I mean, with the exception of part 2 of the IT infrastructure, year 2, which is 12 million? Do you agree that these are the priorities still? Because you're the new CEO now, so these are what I guess this team has developed. And do you still agree that these are what should be prioritized as far as CIP, that we should do demolition and renovation of the MRI building? When you say renovation, what do you mean by that? Is it just demolition?
So there's two schools of thought that are being considered: whether the building can be rehabilitated and further used for services related to imaging, or if the building will be rather used as a parking lot. That is a conversation that our interim CEO will have with the Board of Trustees with the use of the building and then the appropriate costs associated. If the investment is not sound for us to dump millions of dollars into a facility that will not be utilized to its full potential, then the parking lot might win the argument.
All right.
I understand that when you look at the list and you look at increasing parking, it seems like it's something that, you know, it would never be a priority. But it means everything to our staff. And it makes it improves our efficiency when patients are coming through our doors. It is the one low-hanging fruit that upsets everybody. Our staff have to come in and sit in the parking lot until the morning shift is done. We've had to get creative with visitation hours. It's very difficult to find parking at the hospital. So as much as that seems like it's not critical, it's critical to the staff that have to work in that hospital, and it's critical to the patients that are served in that hospital.
All right, and so who will be making that determination as to what is the 19 million ultimately going to be spent on? What is your priority? Are you going to go with the old priorities?
What I would like to do is go through the list, and I'd also like to get the board involved, the Board of Trustees.
Say that again.
I would like to go through our list and ensure that we have the support of the Board of Trustees, our Board of Trustees.
All right, well, all right. I'm not saying, we have a very, very long list of CIP projects for the hospital that need to be done. And so this, yes, has been on that for years. So I don't question whether it needs to be done. My only question to you, coming in fresh, is if this is your priority as to patient care. Because we can't tell people, oh, we had an electrical fire, we spent the money to tear down an old building that no one was using and wasn't bothering anyone, you know, even to create more parking. I'm just saying, that's what we're dealing with here is we also have to justify our priorities to the public. And so I just trying to give you an opportunity to do that.
Correct.
And while we have heard so many more things,
My
patient care
priority
concerns.
is the critical infrastructure issues. So it's the envelope, it is the mold mitigation, it is the life safety systems. It's making sure, it's changing out the switches and then eventually changing out the electrical panel. The problem is that we're only going to get appropriations for this year. The amount that we actually need far exceeds the money that we're getting. This is the first time that we're actually seeing CIP funding. And everything is a priority, this amount of CIP funding. So I do, yes, this is, I think, day 4 for me. I do want to meet with my executive team. I do want to meet with my board of trustees, and I want to make sure that we are all in alignment with what needs to happen for the hospital. It needs to be safer. I am completely aligned with you, Senator Talahi, that that is our priority. If there is, money to improve the parking spaces, then I'd like to do that as well. But if there isn't, then the life safety systems are going to be our priority, period.
All right, thank you. And again, yeah, so CIP projects for the hospitals, an ongoing issue, right? Which I believe at least I have tried to make sure that you receive, the hospital, GMH receives, no matter who the director is or the governor is, that they receive some CIP, even when they don't request it, even when the governor doesn't give it, even when the governor takes away the ARP, CIP funding in the last minute that they had planned to use on some of these exact same projects. So I don't think that you need to convince me or the people of Guam that we need CIP projects at the hospital. We just need to convince them that what money we do have and make available, you're going to go after aggressively. You're going to make sure you use it really to take care of them, to take care of these patients. So
Absolutely.
Thank you. Thank you, Mr. Chair.
I understand, Senator Lai, that there's been monies appropriated before. The advantage with this team is that we have new eyes to be able to look at it. We have new sets of priorities and also plans in terms of trying to accomplish these things. I appreciate the fact that it's been done in the past, but give us a chance, give us an opportunity to get it done.
Absolutely, we're relying on all of you. So more than a chance, we're trying to give you our full support. So thank you very much.
Susmasi, Senator Talahi, and you're right. You're right, because there may be a difference in the breakdown in terms of what the savings are and what you need for your projects. But that's where we are here now too, to say, hey, if we've got this 19 million now, but we know what the future savings are, this body is going to say, at least hopefully most, if not all of us, will say it's for GMH. Senator Tadigui, you recognize at this time.
Thank you, Mr. Chair. And thank you to everyone who's here testifying and all the hard work you're putting in. We're now doing everything we can to give you more money, to move forward on this. I hope the amendment we made to allow emergency procurement up to $10 million is going to be very helpful, because we know that a lot of times you're bottlenecked. Many times you're bottlenecked in trying to move, get procurement through. So if there's anything on the procurement side or what we can do to help you to move these projects through. The $40 million that you just received through Public Law 3859, it mentions here on October 15th, the anticipated $7.5 million. It doesn't say where it's going. And on October 30th, it's anticipated another one of another funding of $5.98 million from DOA. So where is the intention of using this funding?
From the rest of the money that will come in, it will come in from DOA as agreed upon with the Director of Administration, what that cash flow will be coming in. So we are going to set aside the $10 million for the IT and the electrical panel, as we're supposed to. The rest of the money will be used to pay the existing vendors that are on our AP listing for FY 2025 to clear that out.
Okay, so you said the electrical panel, correct?
Mm-hmm.
Okay,
yes.
So that has nothing to do with the utility system. That's all for the electrical panel then?
Yes, ma'am.
Okay. Okay, I just thought that might, especially the electrical panel, would be what actually priority more than paying doctors. You know, it says 1.3 for doctors' pay, and then further down, all these other ones. I just thought that that was something that you would start right off the bat. You know, that's an emergency. I mean, we had a whole front page news talking about how it was an emergency, and why was that not considered priority?
Senator, if I may respond to that, we can certify the funds based on the appropriations by the legislature. So it doesn't mean that the projects aren't actively undergoing the process of requisitions and awarding of the bid. Instead, we're looking at what bills are due and then paying out the bills as they're due. So the project is still moving forward, and until such time that the item arrives and then we owe that vendor, that money will be set aside in October.
So you are actively doing it? Then,
Yes.
Everything that needs to be ordered is being ordered now? Today.
Correct. We're putting our
Okay,
plans.
well, that's
yes.
good to know. And then I noticed, yeah, that 7.5 and the 5.9, so we can just set that aside for the electrical panel, correct? Okay, what is left over, you said, for the IT side? Because we notice here in infrastructure, we're kind of short from that 12.7 million for that. So do you think some of that money would be able to go there, or how soon? Well, this says year 2, right? So we're looking at what, 20, I mean, we're not far away from 26 at all. So when is this anticipated? You know, it's good to find out these dates, because then we put your feet to the fire when it comes to something like that, and we can follow through. That you said that you would start this project on X amount of time, and I mean, you guys lost $10 million because supposedly the governor said that you didn't spend any of that ARP money in time, and she took it away. So, you know, finding these timelines are very important, you know, to put your feet to the fire on this. So what are the timelines, especially for the IT side? Because this is very, very critical. We saw what happens. I mean, we almost thought somebody hacked into the legislature here and shut down our system. You know, this is a reality, and it can happen so easily. So can you tell me the timeline on your IT infrastructure?
If I may.
Yes, please.
So on the IT infrastructure, we're already in the process of the procurement of some of the items on there. So it's not like we're forgetting about it. So just to clarify also, of the $10 million that UCA will be setting aside for CIP, $5 million of that will be used for the electrical panel, and you know, the pertinences there, and then the other $5 million is to address our IT needs. So just to clarify, ma'am.
Yeah,
but yes, we've already started the process.
Okay, but can you give me the timeline? I'd just like to know what the timeline is.
So as far as some of the items, recognizing that some of the equipment that we will probably need to get, they're long lead items also, so it'll still take anywhere from 6 to 12 months for us to receive the items.
This is the electrical health record system?
No, this is for the IT network. We need to first address our basics. And so that was what the $5 million is going to address for us. But keep in mind that that $5 million is really only to address the first year of our network.
When does that begin?
This fiscal year.
Okay, so we're starting 2026. So this is going to be $5 million needed for the network system setup. But when does the electronic health record system begin?
So the EHR, that is what we're asking for as part of the $32 million.
Or 19 million.
Or then, yeah.
Yeah.
So it'll be part of that appropriation, ma'am.
Again, what's the timeline?
May I speak? Thank you.
Yeah.
Okay. The EHR has to come after we do the IT upgrade, because the EHR will not be supported if we don't fix the engine.
Right.
So what the first $5 million is going to do is change out the entire wiring. They're going to gut it out and rewire the hospital so that it can support an EHR. So that has to happen first, Senator.
Yeah, and I'm just wanting a timeline on that. You know, how long it's going to take you if you're already in negotiations? You should have a timeline. Anybody
So we're not in negotiation with an EHR. let me just make
No,
that.
I'm talking about the first infrastructure
Oh, for
part.
the
Yeah,
IT.
the networks.
Okay.
Yeah. What is the timeline?
About 6 to 12 months is what
Okay,
they're
so
saying.
we don't expect to have anything up and running with the electronic records until 1 year from now.
Yeah, it really needs to be laid down first.
Okay, that is quite long, you know. Okay, that's what I need to know from 1 year today. Okay, the other one is, of course, we read into the record, I think the chairman read into the record about the funding amount. You know, I don't want to bring you guys hope when, you know, or money that you need, that desperately needs right now. That is not a reality. And I think if you've read the fiscal note from BBMR, it clearly states that that there is only 19 in savings. You know, we've already set aside the 32, and now we're looking at, you know, not having so much to pay on that bond, and only making it, giving us more of a savings of 19. So, yeah, it might be time to readjust those numbers. Other than that, thank you so much, and we're here to help. Just let you know that, you know, every time you come in front of us, please don't take it like we're drilling you to fail. We're not. We are helping you to move forward, and that any mistakes or any concerns that you have, this is the time to speak out. I know you answered to somebody else, but really, I remember in the 35th of 36, we begged Guam Memorial Hospital to tell us the true amount of what they needed in their budget. And they kept coming to us with only like, what was it, Senator Chulai, was it 32 or something, or 23 million, that was it? When in reality, they needed 70. But they didn't ask. And that's the problem. So please, this is the opportunity for you to ask. So thank you.
So on that note, Senator, I am going to ask.
Yes.
I'm going to ask because you have offered to help us with the procurement, and I am asking you to help us streamline this. I'm asking you to break any barriers because our law is very old. And so we can give you timelines, Senator, but if it's stuck and we're not within that control, we are still going to be the body that is blamed for it not being done in 6 to 12 months. So I am asking for your help to ensure that the process run very smoothly for Guam Memorial Hospital to handle its life safety issues and anything moving forward. Any process that this body can do to help expedite and make things efficiently for the hospital to obtain what it needs, that's what we need help with. Because I can give you timelines, but if it's out of my control, then I may not be able to meet that timeline or that deadline. So I'm asking you, Senator, to help us. I'm asking this body to help us.
Thank you so much, Doc, for that. I truly, truly appreciate that, because I do know the issues you have with procurement, and that 10 million, I'm afraid, might not be, sorry,
if I may
might
add,
not be sufficient. And whatever we can do, we need to find out where your bottleneck is, where you're having issues to move forward, and if it needs to be create legislation or to have someone designated at the Attorney General's office to ensure that these go through. But the one thing that we can't forget is just transparency. That's the one thing. We need to be fair and transparent. We just need to speed, you know, move this faster. A lot faster than we're known for. So thank you so much. Dr. Eusebio, you had something?
Yes, ma'am. Part of what I see is the problem is that a lot of times money is appropriated, but it's monopoly money. It's not real money. And what we want to do is we want to take the concrete money and spend it.
Right.
You give us concrete money, I assure you we'll spend it.
Absolutely. Thank you. And that's what we're trying to do. At least my bill does, the next bill. Thank you.
Jesus Masi, Doc, absolutely, no question about it. This bill can be amended, and now that we've got everything on the record, with regard to where we are and what projects we have going forward. I mean, if we didn't put the 32 million out, we wouldn't have had your list of projects like this that we now have for the committee report. Keep in mind also, now that you've put on the record your 40 million and what it's going to cover, we're going to see in the first quarter what the excess revenue looked like. You still have $20 million in excess revenue in the fiscal 2026 budget as passed by this legislature. So that is, well, now that we know your projects and the like and everything else, if it's taken care of going forward, as Rodlin and others have identified, then you already have this on the record and can proceed even if we need to adjust that appropriation. I think that's probably what we're going to do going forward, Doc, is we're going to come back, and when we realize that revenue, that's when we can start doing what we're doing here, which is attaching these projects that are slated and then attach that appropriation to it. But just keep in mind, and here's where I think we'll probably end up, Dr. Ogden, is you might be aware there is an OPA report that just came out on GMH, and there's some issues, and so at least findings. And so what I look forward to, because you've brought it to light now, and I'll work with the oversight chair after this hearing, we will immediately look on the calendar and find a date to have a joint oversight with GMH and the OPA so that we can iron out the issues that have come forward. And Doc, please bring the board, please bring your team down here, and let's put it once and for all on the table exactly where these bottlenecks are in procurement and the like, and let's make recommendations in the open public so that if we need to introduce a bill, even if it needs to be, expedited through the process, that's what we'll do. If that's the log jam, if that's what it is, well, then we'll get to work. And so I'm looking forward to the Oversight Chair for Health, the hospital, to join me and in the earliest calendar to put a roundtable addressing the current OPA's report, as well as things that you brought to light, Dr. Ogden. Vice Speaker Ada, Vice Speaker of this committee, you're recognized.
Thank you, Mr. Chair, and good morning, everyone. Thank you for being here this morning. I appreciate the handouts that you gave us, especially on the 40 million GMH appropriation report. Today now is October 6th. Where are we at with the vendor payables on the September 30th?
So far to date, from the 40 million, there's been about 24.6 million that's been paid to the vendors from the listing, from the accounts payable listing that we submitted.
So is this September 30th, 10 million vendor payables, is that completely exhausted?
There's about $400,000 left on that one that we're still processing.
400,000? Do you have a list that shows what vendors were paid? Yeah? If
Yes.
you can provide the committee with that listing, we
Sure.
like to see all the vendors that have been paid with this 10 million or 9.6 million, and
Yes,
then
I'll provide that.
the remaining 400,000. And I know at the oversight hearing up at GMH, we did bring up the issue of, or at least it was mentioned, the $10 million that still hasn't been received from the administration to GMH. And the answer was, well, we can go after it. Has any effort been made to go after that $10 million?
Just to clarify, is this for the 40 million?
No, this has been the previous.
The CIP?
Yes, so it was, I believe the 10 million that was appropriated for the electrical panels previously, that was not collected, and the question was, all right, do you guys plan to collect it? And the response was, we may, we may look to collect it. And they said, instead of may, that should have been, so no effort from the date of the oversight to today has been made to collect that 10 million.
My understanding is legal is working on it, but as far as where he's at on it, I'm not sure, but legal's working on it.
Yeah. And thank you for that. Doug, I understand that we talk about hard cash. This is where hard cash comes in, right? And just like the $10 million on CIP that was taken away from GMH, that was actually hard cash there. So I'm not sure where the where and why it was taken back. And again, that was an additional $10 million for CIP improvements. I think this legislature, in the 9 months that we've been in office, has appropriated perhaps more funding to GMH than has been in the past, in 9 months actually. So I think we've been very open in working with the Guam Memorial Hospital to ensure that your needs are met, but it's a two-way street at the same token, right? I understand that procurement is perhaps an issue, and where is it that we can work together? But the question also comes back now: are the people at GMH, do they have all the modules of the procurement, and then are the folks that are there also certified for procurement, right? So it's a working progress that I think that we can come together to ensure that we do the best for both the people of Guam and the hospital. And I think what we also need to look at is the additional revenues, whether it be 32 million from one bill or 19 million from another bill, that they don't go backwards, right? This 40 million should be paying for everything previous, and this additional revenue should be actually moving forward. And I just hope that that would be the case, and not where we're saying, I know one bill says that it's not going to be used for salaries or additional hiring, but there's always a way around those lock boxes, right? Well, we'll use funding from somewhere else, and then we'll fill that with additional funding. But I hope that there's going to be a very tight rein on what personnel is needed at the Guam Memorial Hospital to ensure that it's operating not just at full capacity, but operating at efficiency, so that we're not using funds where we don't have to. And for example, the $300,000 to tear down a old MRI building, I agree. That will probably open up, 10 parking stalls, but $300,000 could actually be used to, provide more supplies. And I remember that one gentleman that was outside during one of the public hearings said, we need supplies, So I'm sure that prioritizing on where the needs are is going to be very effective in moving how we work together and getting the hospital the needs. So I really don't have any questions. I just want to just let both of us know that we're here to work with you, but at the same token, work with us. And Doc, in your interim there, your time there, we're looking forward to a lot of things happening. But at any time, please have your board join you down here so that we can know what they support you on and what they don't support you. Because you could be saying one thing, and that's not going to be the sentiments of the board. And likewise with the board, they're going to say, well, we want this project to move forward. You're going to say, that's not the priority. So, anytime you have an opportunity to bring your board down with you, at least a chair or, a couple of folks, bring them down with you, because I think it would speak volumes as to how are we going to be able to work together and ensure that, you're not thrown under the bus, the board's not thrown under the bus, but the legislature is not thrown under the bus as well, right? And that we're looking for ways to actually make things happen. And in the end, I believe that we'll be able to find the solutions for the issues before they actually become problems. Because right now, there's a lot of problems that now it's just totally hard to try and remediate those problems with what's going on in collections and revenues. So before an issue becomes a problem, let's work together and solve those issues. Okay? Thank you, Mr. Chair.
Thank you, Vice Speaker. We actually have created a task force to specifically look at the procurement issue, because we need to be able to understand why the not in stock or low in stock items are not being delivered, or where the problem specifically is. And so we're looking at that and going through in detail from one step to another so that we can provide an answer to that problem. Be glad to give you the final findings of that report if you want to.
Yeah, that would be great. And you know, just as we did just recently, we granted the Mayor's Council of Guam procurement authority of up to $500,000. And you know, something like that where you'd be able to meet your needs for these small deliverables, right? You know, things that can be acquired quickly and not go through this whole process just to get, 10 packages of Band-Aids, whatever it may be, that the process will be a lot smoother and a lot quicker for the Guam Memorial Hospital. And that way you don't fall so far behind with your vendors, and vendors can be paid perhaps quickly, especially with small procured items. Yeah. Thank you.
Vice Speaker. Senator Gumitato, you recognize?
Yes, thank you, Mr. Chair, and thank you for the panel for being here. And I do appreciate you, Dr. Uggan, being on the job for 4 days. I've been on this job for 10 months. It's exactly what Dr. Eusebio said earlier, that the issues of the Guam Memorial Hospital require a new set of eyes. And I know this is not an oversight hearing. This is a bill to try to get resources, but I think we gotta, all the time, with all this talk here in this building, is all about trying. And to the people that are behind you, I hope you're listening to me, and those that are watching at GMH, no more trying, we just have to do. This list that's before us is also incumbent on other agencies. So they're gonna do. So once you guys get it, there should be no more question. Let's just get this done. There's some great, I guess, solutions for some of your low dollar procurements, and I stand well more than prepared to support that. I think we gave it in the Budget Act. That's only the start. But I just wanted to start with that, because this building is 43 years old. Just across the way, there was another building that was built 7 years previous, and they opened a time capsule of another branch, talking about the good things that have happened there. We're not quite at 50. I would maybe agree to disagree, perhaps, but I think that sometimes we do have old bones in some of the government facilities we have today, or there wouldn't have been hundreds of millions of dollars of infrastructure put into that facility. And I would say that just as we start, because in 2020, the Army Corps of Engineers said, okay, we need to do something, estimation of costs. It's been a while, but is there any updates to that 2020 report? Or are you using the updates to fix this in the bill? Anyone can answer that if you could.
If I may, on the Army Corps of Engineers report, so as we address our electrical needs, we are referencing back to the Army Corps of Engineers report. And in that report, it does talk about our 2019 electrical design. That 2019 electrical design is the first step for us with the $5 million that we were provided of the 40. We are actually in the process of recertifying that plan and taking into consideration the specific areas that the Army Corps of Engineers report is guiding to address.
And that's fair, but also the cost is different.
So the cost, well, as we recertify that plan, then we'll have an updated estimate for the electrical.
Okay, and thank you for that. I think as we look at the other parts of the entire plan as in the bill, obviously some of these demolitions, removals, fire protection, server room updates, I appreciate all those. In your opinion, if you were to get this money in the next session, how prepared is the GMHA to be able to bid these with the estimates you have currently and be done with this in a reasonable amount of time? Are we going to have to wait till 5 more years to do this?
The request is for fiscal year 26 to complete these projects. So the intent is to complete it in fiscal year 26. Or at
You know
least-
you're on the record right now. That's a very
Sorry,
aggressive
sorry.
timeline. You know that, right?
Let me clarify. For some of the smaller projects, then we can complete that within the fiscal year. However, understanding there are projects in here that will require a little bit more time.
Oh, no, I think you mentioned it, not here, not just today, not just in the public hearing for the budget, not just in the oversight hearing. There are long lead items that are going to be needed to be purchased. If this is standing in the way, I know we gave you procurement authority in the Budget Act. I'm hoping that that doesn't stand in the way, that you're able to some of these bigger ones that doesn't require a whole bunch of reports and all that stuff, that you can procure them faster. Because I think that's one of the things that, as people are watching this hearing, is you're coming here, and everyone wants to support healthcare, but it comes back to no more trying. It has to be about doing. You have to go and procure it. I mean, I wasn't here in 2019 for a list of stuff. I wasn't here. Like I mentioned, these are two of the freshest eyes in this building next to the person next to me. And all we're trying to do is be of assistance. So when the policy is set, the legislature is, like I mentioned it in the session, I'm not going to turn a wrench. I'm not going to paint a wall. I'm sure as heck not going to throw out trash, because that's not my role. We're going to set policy, but we're hoping that you in this room, and with Tina's help, and for the record, she does have a lot of experience in this. I'm hoping you can use that to be able to execute. It can no more be, we're going to try. It has to be done. Mr. Chair, that's all of my comments and questions I have today, but I stand ready to support, but I pray that you're going to just do, not try. Thank you.
Senator Gumitato. Senator Matanane, you may, your questions and closing.
Yes. Thank you, Mr. Chair. Tina, if you could, Ms. Garcia, if you could kind of clarify, because I sent you that spreadsheet which outlined the 19 million that was available in fiscal year 26 and the 17 million in savings from FY 27. If you could kind of break that down for us.
Yes, that's correct. When we went out and refunded a portion of the BPT 2015 bonds, we did create savings going forward. And when you talk about current savings for the fiscal year, we identified the 19 million. However, for fiscal year 2027 and moving forward, when we go into the next budget cycle, we no longer identify savings. We actually just provide the actual debt service. And we no longer, because the remaining is freed up for others. So I don't know that you could make that appropriation for next fiscal year today, but that's the call of the legislature. And Senator, I think that's what I've been told, is that we can only appropriate today's revenues for the current fiscal year, fiscal 26, and then fiscal year 27 is addressed at that budget cycle. But when we provide debt service, it's only for the current debt service. We no longer identify savings. With the lower number, it allows you to appropriate for other items. But we don't say there was a savings of this that are no longer tied up, because that money is not there being tied up in 27. Because in 27, we don't have that. We have a bond schedule, a debt payment, but when we refinance and lower that debt payment, we just stick to the new debt service. We don't continually bring up the previous debt service. So that's why we're saying that what's available today is the 19 million.
Today.
Today.
Today, okay. Thank you, Tina, or Ms. Garcia. Whether it is 19, 32, $36 million, I think the main message behind this bill is that we are committed to helping the Guam Memorial Hospital. And I think this legislature, this committee kind of demonstrated that we're willing to work with GMH in the budget. I've told this to the media and other people that the amendments that were made into the budget bill were from the Guam Memorial Hospital. It is evident that that is the partnership that I've committed to with GMH, whether it came to the procurement, the hazardous pay, the $35 million from the new hospital and diverting it to GMH, which of course Adelup was not happy about, despite the fact it was in their budget. So this bill is just another way. When we came in here for the substitute budget that the governor called us down into special session, that's when we found out about this $32 million. And that's why immediately, working with the committee chair and other senators, we wanted to push out this bill to get this money to GMH. And so again, whether it's 19 million or 36 or 31, we can easily amend this bill based on input on how you would like to see this money spent, and we will get it done. So, Dr. Uggan, you mentioned, or I'm sorry, Dr. Eusebio, you mentioned this task force on procurement issues. Please get the report to me, to our committee, and we will do what we can to introduce legislation to address whatever you guys need done to address those problems. In terms of a timeline, if we can get something in writing, maybe by next week, Monday. Also, I'll work on the amendment that you provided in your presentation. As well, there was something else that I wanted to get. I'll just call you guys and let you know. I mean, we have a pretty good relationship and communicate frequently. But I agree, Dr. Eusebio, what you said about there's new minds, there's new sets of priorities, and there's also new leadership. So thank you for coming down and providing your input. And again, we will work on the markup and amendments to this bill, and I'll send it to you so you guys can take a look at it. Thank you.
Suzumansi, Senator Matanane. So just to be clear one more time, Tina, because the $32 million didn't come out of the air. It was actually one of the announcements, proud announcements from the refunding. So just to be clear one more time. The schedule—
Senator,
yeah.
I'm sorry. And I also looked back at my notes, and I apologize. We did recommend to the governor the appropriation of 19.7, and you're right. When she, in her proposed budget bill, she did not include GMH, but the other part of the budget bill, her proposed budget bill included a rollback of the BPT, and that entire amount she was dedicating to GMH. But I just wanted to make that clear that that was the difference between her appropriation of the savings.
Certainly.
Thank you.
Certainly not a question about that. But what I'm saying is when we talked about real money.
Yes.
Because the real money wasn't there for the BBT unless it was going to be realized throughout that year. So we had a lot of talk about real money today here. And so, yeah, so that savings from the BPT could not have been realized at an immediate, whereby this money was available for appropriation because it had been realized and that debt service was no longer accounted for. So once again, Tina, I just need to make sure we understand. Yes, what we do in the future is up to us. But for the people listening and for GMH, they need to understand there is a $17.8 million savings on the schedule for how you refunded the bonds for 2027, correct?
And yes, and that will be available, well, not available, but that occurred beginning October 26, not October 25.
Correct.
Correct.
Not an issue, because I remember even before when we did the tax bonds refinancing, that kind of amazing how it comes full circle. We did Series A and Series B. And we actually went out to market and we bifurcated the go-to-market. So that's how we realized paying the tax refunds, and we anticipated for an additional fiscal year of going out and going to the market. So There is a savings of 17.8 million. I will work with the committee to see if we can project that savings. If not, then we will work on what happens in the fiscal year 2027. But it is a savings that otherwise in 2027, so that the people of Guam don't get confused, they would have had to pay $17.8 million in that debt service. That's not funny money, that's real money that will not have to be appropriated in 2027. And so we will continue to see if there's a way to Series A, Series B. You're getting 19 million, no question about it, 19.8. We'll figure out how we do the rest, but we're here and we now have you on the record with regard to what your needs are and the schedule of projects going forward with real money and eventual real money. So for that will be the conclude the hearing on Bill 18738 COR. And so now we will move to Bill number 188-38 COR. And the author is Senator Talatadegui. Senator Talatadegui, you recognize.
Thank you, Mr. Chair, and I'd like to thank you for having this hearing on my bill, which was introduced only less than an hour from when Senator Matanane had introduced her bill, not knowing she did. And of course, we have different figures in our bills, but nonetheless, you know, the intention is to whatever savings there were from GITA to provide it to Guam Memorial Hospital. It's truly needed for our healthcare, for our community. And it was just the same day that it was done. But I'd been working, Mr. Chair, with GITA since July, understanding that the intention of the refinancing of this bond 2015 D, I think it's 2015 D, to refinance this and to come up with the savings. And then realizing that we would not be able to see this before the budget passed, we had to wait. In fact, I'm sure Tina remembers that it was in the bewitching. We almost did not get this refinanced, literally. On the bewitching hour, we had an hour to go before to make the final deal, and if it was not signed, then we would have missed out. So the front office gave me a call and asked me to assist with getting this measure done, or the signatures needed for to move forward. So I did, I assisted, and I think it was great. It was great for everybody, the whole team that went after this bond. So, Mr. Chair and colleagues and members of the community who were here to provide testimony on Bill 188, thank you for your participation today. Bill 188-38 seeks to appropriate $19,745,714 from the debt service savings generated from the Guam Business Privilege Refinancing Bond to 2025G, which are being used to redeem the outstanding of 2015D. To the Guam Memorial Hospital to fund critical capital improvement projects, including upgrades to its aging electrical system, as well as operational costs and essential medical supplies. I wanted this bill to ensure that it was all around. You know, we're not experts. We don't know your day-to-day operations, and some that are very critical. And as you mentioned earlier, the low-hanging fruit, and being able to procure is very essential as moving forward. So, Mr. Chair, this bill is responsible because it does not appropriate from future, nor savings that are merely expected but have not yet been realized. And I want to make it very clear, too. This refinance of the bond might have saved us $19 million this year, and then next year we won't have to pay so much on it, but it's definitely not going to be a 19 million savings, it's only 17. But after that, we pretty much go back, if you look at the schedule of payments, we pretty much go back to like around $31 million a year. As you know, it cost us $32 million for this bond. When we refinanced it, it took it down minus 19 million. Then the following year, minus 17. But after that, we're not going to see that huge savings. We're going to go only to like 800,000 savings $250,000 savings. It pretty much goes back to $31 million that will be obligated for the next 20 years. So this was a 30-year loan. We refinanced after 10 years, and we maintained the 20 years. So it does not extend out further for another 30 years to lower our debt ceiling amount. It pretty much maintains, but it gives us a little break at the beginning. And what better place to put that break is at Guam Memorial Hospital. And that's why we're here today. So just to explain that scenario. And, I do want to mention, my colleagues had mentioned earlier with BBMR, according to BBMR, the Guam Economic Authority affirmed that the new bond debt service is from 31 million down to 11 million only this year, and providing the 19. So we heard from BBMR that this bill is a reality. It's real money, Dr. Eusebio, not phantom money, real money. And that's why I introduced this legislation, because I'm not one to not cross my T's and dot my I's. Everyone knows that, and I will stand and fight for what's right. Whether it's my bill or not, and that passes, it doesn't matter to me, as long as you guys get real money, and that's $19 million. The only amendment I would make in this legislation would be just to allow procurement of that 19 million emergency procurement and to move forward. I have a meeting actually with the Attorney General today, and I will be discussing these two bills. Whatever bill passes, doesn't matter to me. I don't need the credit. I just need to make sure you get real money, like I said. So to talk with them to actually designate an individual. I know you do have attorneys at your office, at your agency, but I think you need that one signator that's going to move things a lot faster. So I'm going to see about meeting with him, probably putting out legislation shortly after to allow just for GMH. I don't want to set precedents to allow it to be, it will probably be a sunset. But it'd be something just to get this money spent right away, okay? And of course, this is why, well, actually, while we know that GMH needs a lot more than this amount, and they need hundreds of millions of dollars to modernize, than the 19.75 million in savings gives us a practical and near-term solution to address urgent needs now. And reliable power in operating rooms, functioning life-supporting systems, and adequate medical supplies are not luxuries at Guam Memorial. These are essential to saving lives, that is. So I want to thank the bipartisan group of senators on my legislation. When I explained to them exactly where the money was coming from and relying that it is true money, I'd like to thank Senator Sabina Paris and Senator Calvo and Senator Barnett for also co-sponsoring on this legislation, underscoring that when it comes to health care and the safety of our people, we can all unite for this purpose. So I respectfully ask this body and our community to join me in supporting Bill 188-38 so we can provide GMH with the resources it desperately needs today and restore confidence that when savings are realized, they will be used wisely. So, Sijusmasi, and thank you, Mr. Chair.
Sijusmasi, Senator, correct. And I tell you what, one of the reasons why it's so important when you see savings like this come across that you go after it is because it's a frenzy a lot of times. And so when you see that complete schedule and you see next year is only the other big amount available, you might want to try to lock that down because it becomes a problem later on. A lot of competition for appropriations. Dr. Uggan, you're recognized at this time.
Hafaday, honorable senators, on behalf of the Guam Memorial Hospital Authority, I wish to also express our full support for Bill 18837, introduced by Senator Tello Taitegui and co-sponsored by Senators Sabina Flores-Perez, Chris Barnett, and Shelley Calvo. This legislation also aims to address the pressing needs of the Guam Memorial Hospital by allocating resources for essential capital improvements and operational costs. Similar to the objectives outlined in Bill 18738, this measure ensures that the government's fiscal savings are reinvested into areas that directly impact the health, safety, and well-being of our people. We extend our gratitude to Senator Taitegui for her leadership in authoring this bill, and to Senators Perez, Barnett, and Calvo for their collaborative efforts in co-sponsoring this important legislation. Sizus Ma'asi for your time and consideration of this testimony.
Parahaguloku Doc, Sizus Ma'asi. And now I recognize Ms. Tina Garcia, Administrator of GIDA, to present testimony on this bill.
Thank you again, Senator Dueñas, and to the Committee on Government, Finance, and Operations. I'm here to present this testimony on Bill number 188-38. My name is Tina Garcia, the GIDA CEO and Administrator. Again, we would like to take this opportunity to provide the information to the committee that we are here. This bill appropriates the savings from the recent bond refunding of the 2015 bonds. The original budget appropriation for the 2015 BPT bonds was $31.4 million. And with the bond refunding that occurred, the new debt service for fiscal 2026 is now $11.7 million, providing that savings of $19.7 million available for this appropriation and in support of this bill. Again, the bond debt service used in the 26 budget reflected the $31.4 million debt service. We could not relay the new debt service until the bonds had actually closed on August 2025. Again, I'm here to provide any further clarification or respond to any questions. Thank you.
Sizus Ma'asi. Senator Taitegui, would you like to go last, or you want to go at this point? Okay. So, Senator Chalai, you're recognized.
Sizus Ma'asi, thank you again to all of you. And I want to thank GIDA for your work on this refinancing. And I appreciate the savings that has come to us up front right now that we can now appropriate, and that you did talk to us about this during the budget session that we were having. That was made clear that we were going to have savings, but we could not put it in that budget because we were like ahead of the actual event. Can you just tell me, for the overall amount, have we reduced the overall amount that's going to be due going forward, or not?
Yes, Senator, the overall amount of savings, again, will be about $10.9 million. Again, there was some deposits made for the fiscal year 25 debt service that applied, but the total savings again was, I apologize, a net present value savings of $11.2 million, or about 4.2% of the original debt service.
All right, so overall, we're still going to be paying the amount of the bond that we had originally pledged, except for about $11 or $12 million, right? And we're just receiving this upfront savings, meaning we don't have to pay it today, but we're going to have to pay it in fiscal years that are upcoming, except for the $12 million, which is also significant. Again, I want to thank GIDA for their work on this. Is there any condition that we control, that the Guam legislature controls, or that Guam controls, that might get us a better deal on these refinancing efforts?
I know that by legislation, by law, we can refund so long as there is at least a 2% savings from the original bond debt service. And then anything after that, the bond recognizes or the law recognizes that the legislature appropriates the funds.
All right, so is there anything, I mean, that we can make our conditions better for these refinancing that would have given us a better deal?
I think for this one, we actually did very well on our financings. As far as performance, the triple tax exemption held, and we were able to really improve our debt service savings. We had originally projected about a 3%, so we were able to add in another, what they call 100 basis points in savings. So I don't see any other restrictions on the actual bond financing process.
All right. What about the letter from Moody's that talks about impacting our ratings, I guess, and the governor's statement that not fully funding the rainy day fund, those two things?
Right. Again, the Moody's and S&P and Fitch, those are the rating agencies that normally review the credits going out to the bond market, and what they look at is the financial feasibility. Just last January, we were able to go from a non-investment grade rating to an investment grade with Moody's, and that they recognize the creation of the rainy day fund of at least, that they saw that we were making those deposits and the clearance of the deficit. With the new statement, what they said is they understand that with the government services, there's still, there may not be any structural imbalance with itself, but they do recognize that the past few years, the general fund has been supplementing the hospital, and that supplement funding has increased. And they felt that, so as it relates to the general fund, we're okay, but to continue to move forward and assisting GMH, that's what could bring the total financial system. They are going to be looking at it in more detail. So if you read the report, they really go through the funding that has been given to GMH over the past few years, and they've seen the increase in funding. And so they just raised a credit concern that, this could continually stress the general fund itself.
And what about the rollback of the BPT? Did they comment on that, them or the other?
They did make a remark that the rollback could affect our ability to continue to support the hospital at those funding levels. Again, recognizing that it has gone up a lot in the past few years, that we're kind of reducing our revenues at this time when that cost we see going up is going to be a concern. Will be something they're going to be watching.
All right. And so BBMR has, thank you very much again for your work and all of your team's work on that. So BBMR has confirmed that they've only, after the budget was passed, that they only proposed that 19 million of the bond refinancing be used. And so in their proposal, they were proposing 19 of the bond refinancing, or 16 go to Simon Sanchez, and that 40 million in removing that rollback of the BPT be given to GMH instead. So this is less than that proposal, but I completely support that if we do have bond refinancing, we're going to give the total of it to GMH, so I support that completely. I'm glad the bill is accurate in the amount that's actually available for FY26, because as Dr. Eusebio said, you don't want monopoly money, and I think that's what's one of the issues that we have been going back and forth with. In the overridden budget, there was a $15 million appropriation that BBMR and the governor continue to say is not going to be available, that money does not exist. Is GMH relying on that to pay for patient supplies, vendors, and FY26 after the override?
Can you repeat that? I'm not.
All right, so part of the budget that was overridden over the instructions of the governor was to
Yes.
provide 15 million to GMH from a source that, according to BBMR and the governor, is not available. There's no such money. And I'm asking you, what is the impact of that if you had been relying on that 15 million and now that you're not going to get it? This new 19 million is going to go to CIP projects that were not in that budget. So what's going to happen to what you were planning on using the 15 million for?
As far as how we're funding, I mean, I've been following, there's been so many changes in different appropriations for the fiscal year. And what we're doing is not relying on sources of appropriations that have not been duly passed or vetted. I mean, we can't do that. So as these things are becoming appropriated to us, we're adding it into what we can use to support the hospital. So talking about appropriations that had been made or funding sources that had been made that had not been truly passed, or that we would not rely on that.
Let me rephrase it. What is your understanding of your FY26 appropriations today?
To date,
Yeah.
right now, we are showing a shortfall of 21.5 million.
Shortfall versus what, your request?
Yes.
Okay, no, what is your appropriation amount?
87.8.
And do you understand that, does that include the 40 million?
It includes 10 million of the 40 million to reduce the amount that we requested for the CIPs.
All right, so it's, so say the amount again, the total? 87, you're including 10 of the 40 million,
Yes.
but not the 30.
No.
So 10 of the 40 million, are you including the 15 million that the governor said is not going to be available to you in that 87?
No.
You're not? From the budget bill?
No, the budget bill, we're putting in the full amount from the farm fund, the general fund. There was a 5.2 million for the excess revenues of FY23, and then 7 million for accounts payable, and an additional 3.6 to the general fund from the one that was appropriated originally for DOC, and then a $20 million from the unobligated FY26.
Yes, Mr. King.
That's correct, Senator. Her accounting is correct. 87 million, but then 10 million set aside for the electrical panel and the IT infrastructure upgrade.
All right, so you don't include the 15 million. The 20 million, what is that?
I think it's hard to account, Senator, what you're suggesting is the 15
Because
million.
it said general fund, right?
Maybe you're illustrating the $35 million
Yeah,
amendment?
the 35, sorry, 35
okay.
million. Is that included?
So no, that's not factored
No.
into
Okay,
our
that is
operating
not.
budget.
All right, that's good, because that's even worse than 15. All right, that's the funny money. All right, and I wanted to follow up. We talked about where this money would be spent if you get the full savings that the government has received on these bonds that we've dedicated, if we dedicated it all to GMH. So we've talked about those, and I look forward to your prioritizing this. But insurance claims, there were some for Mawar and some for the electrical fire. Would those claims cover any of these items that are on your list? Your priority list?
We had planned to use any of the proceeds, which right now we're not even aware of what amount that amount from the insurance would cover. We have no idea. We've been waiting very patiently for the insurance company to give us, I believe it's the report, in addition to the check, to give us the amount that we considered. But we had planned to use some of the proceeds from that money to cover any of the CIPs that were on our list that was not covered, maybe from the ones we had originally funded from ARPA, and any ongoing operational needs, and any other CIPs that were on the CIP listing that we had provided. But we don't know what that amount is. I mean, it's just a real wild card that I would not be comfortable setting aside, I don't know, 10 million, 5 million, 3 million, we just don't know.
And you're able to, if you receive from the insurance companies, you're able to use that however you want. Is that correct? Is that what you're saying? So you don't...
Generally, yes, but because it was really meant to replace things that had been damaged from the type, we want to fix those things that it was meant for, yes.
Yeah, so I'm just trying to find out if we're duplicating
exactly, yes.
what we're dedicating these new CIP funds for versus the insurance claims.
Yeah.
So I hope we can just see that
Some
in
of the
your
claims
accounts.
also covered like all the overtime and that typhoon pay we had to, so it also covered, part of the claim included things like that.
All right. All right. And if I could get a copy of the task force findings, your procurement task force findings, and the payables from September as well. I fully support this bill that we're going to give the finances that Gita has been able to obtain for the government of Guam, the savings to you for FY26. I believe that's concrete, and that everyone agrees that that is concrete money. There's no dispute at this point that I've heard from BBMR, the governor, anyone. So that's great. That's concrete money. I think while we're looking at a $40 million, or actually an $80 million reduction of BPT in FY27, that's not going to, we're not sure yet how we're going to fund anything that's we're currently funding at that point. So I agree, and I'd like to see, after you get these all settled, what's going to remain paid and unpaid for FY26 and FY27, and so we can come up with potential sources again for that. Gita, CEO Garcia, do you expect any other refinancing in FY26?
No, I think we were only, I think there's one for Guam Waterworks, but nothing else
Dedicated.
for 26, yeah.
And this is not in a phase, this is done, right?
Yes.
All right, okay. Sizus Masi, again, to all of you. Thank you for your hard work. I hope we can support you in any way we can. Thank you, Mr. Chair.
Sizus Masi, Senator. Yeah, absolutely. Funding will be available when it's a priority. Senator Matanane, you're recognized.
Thank you, Mr. Chair, and I have no questions about this bill. I think we kind of went over it previously. So thank you again, GMH and Gita, for being here.
Sizus Masi. Senator Tarigui, any questions? And you may close.
Thank you, Mr. Speaker, and thank you, everyone, for coming and testifying. You know, not just on my bill, on both bills, you know, and advocating and continuing to speak up like I asked you to, and I'm definitely on my amendment trying to incorporate the procurement side of it and see how far we can go on that. I'll probably be giving you a call later on to see how we can improve it. However, I do want to ask how many in your staff has taken the procurement module 1, 2, 3, and 4? Do you have people on staff that have taken those courses? And how many do you have on staff taking those courses?
We have at least 2 on the panel, Senator, myself and Ronaldin, that are complete with the modules.
All 4?
Yes.
Excellent. Anybody else?
Our materials management administrator, and I believe 2 of the senior teams at materials management are already complete with all 4.
All 4, that's excellent. So that gives more comfort to know that they went through these courses. I'm only on Module 1 right now. I finished Module 1. I'm waiting to try and get in the class for the other modules, but it's very helpful to know. And I hope you continue to train as many people, you know, even especially maintenance, and even though they don't deal with the paperwork, but when they're doing the work, they'll know exactly what that's going to be required, that's needed. You know, it's important to also, even though they don't do the procurement side, it's good to let them know, especially the head of maintenance, to take those modules, okay? So other than that, I thank you, Mr. Chair, again for hearing this Bill 188-38, and looking forward to a markup meeting on this as soon as possible so that we can get it on the session floor. So thank you, Mr. Chair.
Senator Tadigui, and once again, I know I said this at the oversight hearing, and it's usually used in a comical way. We're from the government and we're here to help, but we're from the legislature and we're here to help. So we have heard now, of course, Bill 187-38. We will mark up both bills. We will also see if there's any ability to appropriate anticipated savings, and we will see where that goes from there. But I'm just happy that we've now got, it looks like a concrete plan going forward in terms of our CIPs. Because another thing that I wanted to mention, we talk about budgets and what's available for the budgets, and I want to put this on the record again. Now that we're identifying real money for CIP programs, and I know Yuka will appreciate this, given having to juggle and find the money, this now takes it away from what the budget is for the hospital. Because you normally do not budget large amounts of money for capital outlay in a budget. So this takes us to the area where you don't have to be concerned about that, and when we go into the next budget cycle, be coming in and then we're having this discussion on, hey, your budget proposal is $110 million when last year it was $57 million. And it's like, yeah, we know 57 million was pharmaceutical and general fund last year, but we didn't get around to the CIPs and we weren't funded for them. So we have to put it in the budget in order to be able to recognize it. Otherwise, you're going to try to be asking us to do our capital improvement projects with our budget, and that's just not fair. How do we anticipate that we're going to have to pay staff, pay salaries, pay operations, and then on top of that, you expect us to perform miracles in terms of doing these CIPs when it's impossible to do inside of a budget that doesn't recognize it. So I'm hoping that we dispense of this throughout this fiscal year 2026 and ensure that all of your capital improvement projects are set going forward. So when we have a budget discussion for fiscal year 2027, we're not grappling over the fact that the budget amount has to be such an excessive amount past what we can come up with in terms of the money available for appropriation, because we haven't appropriated for your CIPs. And I think coming full circle on that, I think after we have the roundtable with the audit, and we bring the public auditor in and we sort out some problems going forward, you know, Tina, other opportunities within GITA and other opportunities as well going forward, you know, this government has to face the fact that we have a number of CIPs that are outstanding across the board. And they're never going to be funded with the general fund, whether there's a 5% BPT or a 4% BPT. Those capital outlays are going to be funded based on us all coming together, finding out what we have to do, and when we're going to go to market again, that's what we do, because those have to be amortized over time. The reason why we're realizing and talking about this $32 million, the total, of course, over the balance of the term of the loan, of course, is just like if you refinanced your house. Whatever savings you have, you would cash out. That's being discussed now because of the fact that we had to in the past, and we do have to from time to time go out and get money on the market to be able to have an amortization schedule, because most people don't walk around and cash out $1 million house. You put a down payment, and you amortize the rest over 30 years. So Tina, just look forward to us also having more hearings with you and with the team to see what the overall plan for the government going forward. Because doing this piecemeal CIPs and not knowing what that really means overall is, I think, where we really start to just be all over the place as opposed to coordinating. So we thank you for being here today. That will now conclude the hearing on Bill 187-38, also on Bill 338 COR, and Bill 188-38. And so we will adjourn this hearing now, and the time is 11:48. Suzus Masi, everyone, have a great day.